Welcome to Ask Dr. Mingle, the Q&A series answering your questions about quality programs and the transition to value-based care. I'm Kyle Breckel. I'm a digital marketing specialist at Mingle Health, and I'll be hosting this episode along with Dr. Dan Mingle, founder and CEO of Mingle Health. Good morning, Dr. Mingle.
Good morning, Kyle, and good day to all of you tuning in. It's great to see you again. I am Dr. Dan Mingle. I'm here to answer your questions to the best of my ability.
We have an exciting episode today all about MIPS Value Pathways, MVPs. Dr. Mingle, before we get to the specific questions from our listeners, I was wondering, could you just remind us how MVPs work?
Great question, Kyle. 2023 is the first performance year that MIPS providers can choose to submit MVPs or MIPS Value Pathways. It's kind of a cross between specialty measure sets and eligible measure applicability measure sets, currently available in traditional MIPS. Specialty measure sets suggest the set of measures that apply to certain specialties, and eligible measure applicability, that's EMA, measure sets define sets of measures that apply to certain clinical topics that often cross specialties. As I look over the first 12 available MVPs, I see a bit more emphasis on clinical topic than on specialty. Even when an MVP looks to be specialty specific, it typically represents a single clinical topic addressed by that specialty. The upshot is there are likely to be multiple MVPs that apply to any particular specialty, and many MVPs will apply to multi-specialties that will each contribute to care for the topic. To submit an MVP, you'll need to register for it. Registration is expected to be open April 1st every year, and it is open now for 2023. And registration will close November 30th of that performance year. You can change your MVP selection anytime before the end of the registration period. The exception is if the MVP you choose includes the option of the CAP survey, and many of them do, not all of them, you have to register for the MVP with the CAP survey by June the 30th. Now, you can't add CAPs as a measure after June 30th, but you can still change your MVP selection whether or not it includes the CAP survey through the end of registration, November 30th. You can abandon CAPs in your MVP selection if you had previously selected it. When you register, you select your MVP, you list the provider NPIs you assign to the subgroup that takes credit for the MVP. You'll provide a common name for your subgroup. You'll select one of two population health measures that generally apply to all MVPs. You'll select any outcomes-based administrative claims measures, if there are any, available to the MVP that you would like to include in your submission. And of course, you'll select CAPs if available and you want to do it. When you submit, you'll submit 4 out of the available quality measures for that MVP. Now, that might be adjusted by any administrative claims measures that you previously elected that Medicare will calculate for you. It can include CAPs if you've previously elected it. You'll also choose improvement activities from the MVP selection. And there are specific improvement activities available to each MVP. Promoting interoperability is required for everyone, and it's the same for everyone. And your group PI submission will count for each of your MVPs. All applicable cost measures for the MVP will be calculated by CMS for you. If none apply, your cost points will be redistributed. That's basically how MVPs will work. They'll add more MVPs every year, or intend to. At the moment, the proposed sequence of events is that MVPs are completely elective and can be applied to your whole group for the 2023, 2024, and 2025 performance years. Afterwards, you'll have to break into subgroups to do MVPs, but MVPs will remain optional until the expected end of traditional MIPS, which is currently projected but not set in concrete to be after the 2028 submission year. Now, you can expect that may extend out more years before MVPs are the only possible way to do MIPS, but it's extraordinarily unlikely to be any more rapid than that. That it will sunset traditional MIPS. Thanks. I think that's a good introduction to the process. We can move on to the questions.
That was a great reminder. Thank you, Dr. Mingle. Our first question from our listeners today comes from John, and John asks, should we be converting to MIPS value pathways in 2023?
Great question, John. CMS has been working on the MIPS value pathways, or MVPs, for several years now, and 12 of them are ready and available for use in the 2023 performance year. For now, they are available for use, but you don't need to use them. CMS has proposed a timeline that has us ending traditional MIPS and switching to only MVPs by the 2028 performance year. That's just a proposal, it's not set in rules. You can be pretty sure the switch won't happen before 2028, but there's a big chance that it could be more years further out. Between now and whenever we switch over, expect MVPs to be available but not required, and expect the available MVPs to grow every year. That said, you don't have to use MVPs for 2023, but I think it's a great idea. Everyone should be working on more measures than what they need for a full traditional MIPS submission. It makes sense to me that for the extra measures, you work now toward MVP readiness. So whatever extra measures you work on should serve now to introduce you to the MVP process. Now, with few exceptions, measures that you could choose for any MVP are also traditional MIPS measures. The few exceptions are so closely related to traditional MIPS measures, they're not likely to be a waste of time. They still prepare you to use these in traditional MIPS if you want to. An interesting temporary aspect of MPs is that, just like a traditional MIPS submission, one MVP can be used for your whole group, regardless of specialty or universal applicability of the topic to all of your doctors. In MIPS so far, we are accustomed to the concept that the MIPS selections have a halo effect. As long as the group as a whole meets case minimums and data completeness criteria for any measure, the score applies to everyone in the group. That's now also true for MVPs through at least the 2025 performance year. My advice for 2023, 2024, and 2025, make a traditional MIPS submission and make an MVP submission and apply it to your whole group. Medicare will give you credit for the better of the two scores.
Thanks, John, for the great question. Our next question today comes from Jean, and Jean asks, there are 12 MVPs available for 2023. How do I know which ones I am eligible to use?
Great question, Jean. CMS has published specifications for each MVP. You can find the specs on the qpp.cms.gov website. Each MVP includes a statement in the header that says clinicians who practice in the following specialty may want to consider reporting this MVP. This statement is followed by a list of one or more specialties that CMS believes that that particular MVP applies to. Applicability of MVPs is similar to applicability of individual measures in traditional MIPS, and it's similar to specialty measure sets in traditional MIPS. Assignment to specialties is a guideline but not a requirement. The only requirement is that each measure to receive a score has to meet case minimums, which in most measures is 20 eligible patients, and they has to also meet data completeness criteria. From Medicare's standpoint, it's also desirable to measure also applies to you. If you have a little familiarity with MIPS measure specifications, you realize that you can have patients and visits that qualify for a measure, even if you don't provide the care that the measure is measuring. Eligibility is typically related to patient genders, age, CBT and ICD-10 coding. And by your billing, you can be eligible for those measures without actually contributing to the measure's quality. But Medicare, for the most part, lets you be the judge if the measure applies to you. The closest Medicare comes to judging measure applicability is to assume that submission of a certain measure implies that other measures also apply to you. Eligible measure applicability, or the EMA process, is designed to put this principle into practice. Now, if you've engaged us, if you've engaged Mingle to help you with your quality submission to Medicare, we analyze your claims to determine measure eligibility. We can tell you up front with a large degree of certainty which measures for you meet case minimum standards, and we can tell you in which MVPs there are at least 4 measures your group can submit. 4 selected measures makes a complete quality submission in MVPs. Thanks, Gene, for the great question.
Our final question today comes from Greg. And Greg is asking, can my group submit more than one MVP for 2023?
Great question, Greg. Yes, you can submit more than one MVP. The limitation is that any particular TIN provider can submit or be part of only one MVP. It's okay for a provider to have an MVP submission and a traditional MIPS submission. You'll get the benefit of the best applicable score, but Medicare will only accept a single MVP for any particular provider. If your group is going to do one MVP, either alone or alongside a traditional MIPS submission, the MVP can apply to all of the groups of providers. But to do 2 MVPs, you have to assign your providers to 2 distinct and unique subgroups, a different MVP assigned to each subgroup. The only other requirement is that for the measures chosen for each subgroup, the measures you submit have to meet case minimums and data completeness criteria. As long as that's true for the whole subgroup, it's a valid submission. Note, it's not a requirement that each provider assigned to each subgroup an MVP contributes patients to the measures. As long as the subgroup meets case minimums and data completeness criteria, it will be scored and it will be valid. One additional reminder, from Medicare's perspective, a provider is defined not by just their national provider identifier, that's the NPI, but also by the tax ID number in which they're working. A provider is a TIN NPI. Remember also that Medicare defines a practice by tax ID number, TIN, that bills for and collects payments for one or more TIN provider services. So a provider as a TIN provider who works in more than one TIN practice, has MIPS obligations and the full array of MIPS choices relative to each practice in which they work. Thanks, Greg. I hope this answers that question about multiple MVPs for 2023.
Yeah, thank you, Greg, and thank you to John and Jean as well for the great questions. I want to remind our listeners that if you have a question for Dr. Mingle, you can leave it in a comment on YouTube or LinkedIn, or you can email it directly to us at hello@minglehealth.com. And thank you, Dr. Mingle, for sharing your insight with us today.
Thank you, Kyle. And thanks to all of you for the great questions. I want to be helpful. I want this to be useful to you. Please correct or supplement my answers. Share your experience. Ask your questions. We can be smarter together.